or social workers or counselors who were in one setting and expressing significant burnout related issues. And then they moved to another setting doing the same work and not endorse those same kind of symptoms. So it's more related to the environment or the organization than the actual work itself. And it tends to happen over time. You know, it's not like you kind of wake up usually and be like, oh my God, like I'm burned out. You may have that awareness all of a sudden, but it probably was escalating over a period of time. And it often leads to employment change, you know, which is not surprising. So moving on, the dimensions of burnout, it's kind of conceptualized as comprising three different things. One is emotional exhaustion, and we'll get into that a little bit of what that is, but it kind of is what it sounds like it is. You're in this field in particularly, you can get tired of caring for people, right? You can get tired of the ups and downs and the joys when people have big breakthroughs medically or psychologically. It's dampened. You don't feel that kind of excitement. And in the same way, when bad things happen, you don't feel quite as sad from it. You're just kind of like dampened emotionally. Depersonalization and the kind of related cynicism, where you can begin to kind of have this like this kind of arbitrary barrier you put between your patients is almost protective. Like, I'm just not going to care about them so much, right? And you're not really saying that, but it kind of begins to happen, this sort of protective stance. And also cynical, like, well, I'm really not going to make a big difference anyways. People are going to continue to be struggling. I can do all this, but look what's happening out there. And then reduced personal accomplishment. So the idea that people don't feel as successful professionally. They begin to get very preoccupied with whatever mistakes they've made and begin to think that they're not particularly effective. So, you know, in these kind of correlational studies, because again, I always think about things from a research design perspective, it'd be pretty unfair, or maybe unethical, to randomly assign people to a burnout environment versus a resiliency environment, right? And then see what happens. Let's see what happens when we do that to people. So basically it's studied in a focus group or correlational type studies, right? But they found that in the health profession arena with burnout, people reporting an adverse effect on patient safety. So there's actually more patient safety issues as a result. Alcohol and drug abuse, so folks who are feeling more burned out are more likely to endorse alcohol and drug abuse issues. Depressive symptoms, affects patient satisfaction. So there's actually been studies that looked at organizations where kind of on an aggregate level, the staff were endorsing high burnout. Their consumers or patients on an aggregate level were reporting more dissatisfaction. So those kind of relate, you know, again, correlational studies. Increased risk of hospitalization, so the kind of cardiovascular and other types of issues that are associated with burnout. So people going to the hospital more, getting sick more often. And actually, as far as like suicidal ideation, and we've talked about this on this echo and other echoes around the heightened risk of suicide for healthcare providers and physicians specifically, but other healthcare providers as well, were more of a risk than the general population. So emotional exhaustion, again, that's one of those components of burnout. Is some of the ways it's thought about as fatigue, feelings of being overloaded, loss of energy, and wearing out. And sometimes, like for those of us who maybe are not quite as in touch with our emotions, we might feel it just as like, I feel lethargic all the time. Like I just can't like feel like I got the mojo to do the work. The depersonalization can be loss of empathy, like I mentioned, being very isolated and withdrawing from people, including coworkers. And this is oftentimes like a really double-edged sword, because you're beginning to maybe feel unsatisfied at work while you're beginning to withdraw from people, and therefore the people who might be able to support you are not there to be able to support you because you're not reaching out. And then the reduced personal accomplishment, so the feeling of being less competent, inability to cope with the role, just feeling like basically the workplace would be better off without you. I have some study from 2017 that looked at physician burnout rates, and it did it by type of physician specialty, but the entire across specialties, there was 40% or more by specialty of respondents indicated that they're experiencing burnout. Emergency medicine, probably not a shocker, was at the highest with 59%. OBGYN just below. We had some family medicine people, that was just below at 56%. And our good friends in psychiatry are sitting easy at a 42% burnout. So that was obviously making light of that.
Right. It's a lot.
Yeah, it's a lot, right. And this is a Medscape survey that comes out regularly and taps basically U.S. physicians and reported burnout. And what do physicians report, or some of the reasons that they're burned out? They actually, interestingly enough, probably not interesting to you all who are physicians would know this, but the bureaucratic tasks, just all the things that have to do with not seeing patients, right? As well as spending too many hours at work, which I would have predicted that. So that work-life balance gets out of whack. Feeling like just a cog in a wheel, so not feeling very empowered and not feeling like you're making perhaps a huge difference in the overall landscape. And then the last one, which I think everyone can get behind this, the increased utilization of the electronic medical record was one of the other biggest factors that folks reported as being a part of burnout. There are other things, though, of course, like family stress, threat of malpractice, lack of professional fulfillment, all sorts of different things that were reported causes. So for medical students, there was a study, in 2017 that looked at a sample of 300, just below 299 medical students. And we're looking at basically tapping their kind of aspects of burnout around their second semester. They found that 15% met all the criteria of burnout, and 25% reported low social support. So prevalence of the problem, these are some estimates that medical students, up to 60% are experiencing burnout at some occasion. And again, very much like we talked about burnout earlier, it may vary by institution and by year in the curriculum. So there may be certain institutions where there's less burnout and others where there's more. Residents around 15 to 40%, and again, that varies by specialty. Pharmacy students, data is less clear for pharmacy students, but around 40%, 40 to 50% of the folks in pharmacy school are estimated. Oh, can I do this? Yeah. To have anxiety and depressive symptoms, which could be a proxy for burnout, right? Not exactly a totally clean way of looking at it, but nonetheless, people in distress. And then healthcare professionals in general are estimates about 89%. And from working in social services and behavioral health for 20 some odd years, that really seems about right to me. There's a pretty high, especially depending on the population and things like that, and your environment, pretty high rate of perceived burnout. So basically this means that it might be, about 4 out of 5 people altogether at some point in time are experiencing some degree of burnout. And these things are on a scale, right? And it's probably not at all time through all the person's career, but at certain points and certain level of distress associated with it. Really quick, vicarious trauma is associated with burnout specific to healthcare providers. And that's basically there's research to suggest that healthcare providers who've never experienced direct trauma themselves nonetheless begin to experience, some of us, PTSD-like symptoms. And it's from hearing about people's trauma, it's from seeing trauma, it's from being exposed to it. So basically, this is just kind of trauma-related symptoms that healthcare providers can experience by helping people who are suffering. Compassion fatigue is pretty similar to emotional exhaustion, but specific to being in a healthcare provider role, where you just kind of feel like you're not there anymore. You're just kind of like an empty vessel of a provider, and you go through the motions, but you don't really connect, empathize, feel people. And again, that's protective. It makes sense. When you have people you care about and bad things happen, it's kind of natural to begin to build up a guard and keep this kind of detachment. unfortunately, that can tap some of the satisfaction from the work too. These are some self-assessment tools, the Maslow, and I'm probably butcher that. I don't know if I talk about it all the time, but I don't know if I know how to pronounce it correctly. Burnout inventory is, you can access it for free there on the link, but it's a widely used and validated psychometrically sound way of tapping kind of burnout, and it relates to all sorts of things. So now it's in positive, right? Why not? For whatever reason, people also find significant satisfaction through working in these environments, right? And helping people who are suffering and being a part of people's recovery and health recovery processes. And for many of us, when we are able to attune to that, it helps with having an open mind about our own lives. I've seen people solve problems in multiple ways. And when I get into my own jams, I'm like actually drawing on what some of my clients have done. I'm like, yeah, maybe that would work in this thing. It can help with being adaptive, having stronger relationships. Really, I think from the work I've done, I've really invested very much in my role as a father because I see how important that is. Being aware of our own personal strength, that we have the ability to be with people who are suffering, having spiritual awakening or finding meaning in the work that we do. So we're not the cog in the wheel. We're part of this entire sort of safety net that's constantly advocating for and supporting people who are suffering, appreciating life, right? When you see people where circumstances happen, I haven't had as many patients die, but I've had lots of people who've gone to 20-year bids in prison. And it makes me pretty appreciative of the life that I have. Calmness, clarity, creativity. So what are some ways that we can maybe get there? There's organizational responsibilities, there's work group responsibilities, there's individual level responsibilities. So in terms of organization, looking at the work schedule, allowing people flexibility where they can. Someone was mentioning taking breaks, ensuring that people take breaks, but also ensuring that people can take breaks and not be jeopardized in terms of productivity. Again, these are hard things to figure out. I had to get grants to get money to support these kind of things. It's the only way I could make it work, but they are out there. You can get grants that support people to do resiliency work so they can actually take breaks. Work group. So I think really helping people with clear communication. I was listening to something on NPR the other day that said, if you email somebody something twice and it's still not clear, you need to meet face to face. Because there's so much drama that can happen in the span of sending those type of communications. So working with people, helping to resolve conflict and having supervisors who are comfortable with conflict and helping to people share and resolve conflict. Encouraging establishment of social support. We did at my job. I was a director, so we did it for the work group. But they had protected time where it was they didn't lose productivity, and they got to the point where they would tell people their triggers, and they would tell their colleagues, when I'm having a bad time in my life, this is kind of what I look like, and what I want you to do is invite me to lunch. And they had that kind of communication with one another. That's deep, right? But it took a while to get there. And then there's some other things that's kind of related to that. We used the compassion fatigue workbook as part of our, again, it's good for supervisors not to be in those meetings and to be with supervisors, but my direct line staff was that. Also trauma stewardship. It gives pretty cool exercises and activities for work groups to do together. Creating time and space for people. I don't have time to get into that study I'll talk about that study at the very end. At our community mental health center that I worked at as well in Cleveland, we wound up getting space to promote staff resiliency that had the full spectrum lighting and the light music and lazy boy kind of a thing. And people used it a lot and would kind of tap out and spend 15 minutes there. And at the individual level, it's really a lot of things that you all talked about. Some thinking about your work differently, thinking about your performance differently. If you're a mindfulness kind of person, mindfulness. If you're a religious type person, maybe you need to double down on your religiosity. Understanding yourself and trying to figure out what relaxation strategies work and who on my team might do them with me. And here's just some other things. Delegate. I just like to say that. Delegate to people, including at home. Tell people to do the laundry. Say no to people, both in your work life and in your personal life. I got to a point where I'd seen so much trauma. I can't watch anything that has to do with trauma anymore. Like I don't watch it. And oftentimes I watch sports for the most part because I don't have to worry about that there. Peer support groups, things like this. There's research that suggests that people who engage in echoes have a higher satisfaction and joy with work. And I think part of that is you're learning something, hopefully, and part of that is you're communicating and collaborating with other people who are doing similar stuff. So hopefully that's it. Yeah. Yeah, and that's a bunch of references there, a bunch of resources. So thank you all.